Hello, everyone, and welcome to our webinar today on Are we training One Health professionals to meet decision makers' needs in a rapidly changing future? This webinar is a partnership between the McEachran Institute, a Canadian charity, and the Cambridge University Press's journal, Research Directions One Health. My name is Richard Kock, and I'm editor-in-chief of the journal and today's chair. I'm thrilled to be taking part in this webinar, and without any further ado, please let me introduce the three speakers that we will be hearing from shortly. On our panel today, we have Dr. LeAnn White, who has taken on the very prestigious position of Center Director at USGS, that's the United States Geological Survey, National Wildlife Health Center in the United States. In addition, we have Desalegne Degefaw, who I've known for very many years, working in Ethiopia. He's country director at the Ohio State University Global One Health Initiative, and based in Ethiopia. And finally, and certainly not least, Professor Craig Stephen, one of the global leaders in thinking around the One Health approach. He is executive director at the McEachran Institute, and he also is an executive editor for Research Directions One Health. We will hear from all three speakers in turn. Before, we'll be taking some time at the end of the webinar to answer any questions that you have. But please don't hesitate to send them at any point during the discussion. I want to make sure you're aware of the Q&A and chat functions on your screen. Any questions that go in will be managed, and even if we don't answer them during the session, we'll ensure they're recorded and we will get an answer to you. There will be an email link. If you experience any technical difficulties, our team will also give you support, and you can use a Q&A and so on to get that message across. We'll also be recording the session today and sharing the webinar online. Our first speaker will be Dr. LeAnn White. So LeAnn, please begin when you're ready. Thank you.
All right, thank you, Richard. Give me 1 second to share my screen. All right, thank you again for inviting me to speak today. So since this is a presentation or a conversation about ideas, I thought it might be helpful if I started with sort of a summary of what I'm going to say, just to sort of give you an overview of how all of these ideas connect together. Starting with that, I think it's important to recognize that it's a hard time to human right now, and that I think we desperately need some tools for dealing with the world as it actually exists, which is increasingly interconnected complexity. I also think as a unit, we need to stop waiting for other people to save us and figure out what it will take for us to get out there and lead. And then that we need to stop trying to be right and aim for being curious. So that first point about it being a really hard time to human right now comes from something that I currently grapple with. And with so many things happening, like the aftermath of the pandemic, polarization of countries and their political systems, an environmental polycrisis, and globalization of economies, cultures, and populations, we're just all bombarded with information about all the things happening in our neighborhoods and our countries, as well as everything happening everywhere all the time. So when I find myself more times than I'd like to admit thinking it just feels like too much, I'm trying to get better at acknowledging that these are all perfectly good reasons, probably actually really intelligent reasons, to feel destabilized, sapped of motivation to do all the hard things required of us all day in and day out, and sometimes a bit paralyzed in our decision-making as we try to figure out the least worst among a series of choices. So pausing and offering yourself some grace for feeling overwhelmed can be helpful, because all of this is objectively hard. But I also want to say that offering yourself some grace is different than shoving your head in the sand, because I do still believe this is an all hands on deck kind of moment for humankind. So next I want to touch on what I think we're trying to achieve with One Health. There are a lot of definitions out there, but the one I really like is a recent one from the One Health high-level expert panel, which I'm sure many of you have seen. And it points out that One Health is an integrated approach for sustainably balancing the needs of people, animals, and ecosystems, and that it recognizes the interdependence of these systems. I really like this definition because to me, One Health has never been something new. It's just a description of the way the world already works. And how we can optimize these linked parts is through mobilizing multiple sectors to work together, which I think we sort of know in concept, but are really struggling with the implementation of. So again, One Health is all about interconnections, both in the natural world and increasingly in the human-made world. And these interconnections are exactly why tackling One Health problems is so hard, because we're dealing with a system that includes not only biological components, but also social, political, and economic connections. And the decisions made in one sector through a series of feedback loops eventually influences all the sectors. So a set of tools I think we need more than ever is called systems thinking, which is actually both a methodology and a set of tools for generating holistic understandings of why something is occurring and how we might be able to intervene with minimal unintended consequences. It's really hard to explain an entire field in a couple of minutes, but as I reflected on why I think systems approaches could be so helpful for One Health problems, it occurs to me that as wonderful as our minds are, we use all kinds of heuristic shortcuts to keep from being overwhelmed by complexity. And then to make matters worse, it's really hard to change our minds because we didn't evolve to just wander around in a state of wonder. So we use our experiences or those of people who probably think like us or value the same things to make decisions. I think this is one of the reasons why storytelling has become so popular lately, because people are starting to realize that you're talking about your experience, and that's much more influential to people than showing them pie charts and graphs. So systems tools like management flight simulators, including the one you see here called fish banks, are really powerful because they create an experience, by which I mean it's in the process of letting people make their own decisions that people naturally become more open and curious about the dynamic complexity of a system. And they start to wrap their heads around important concepts like time delays and trade-offs and counterintuitive cause and effect caused by multiple feedback loops. And I think another critical aspect for One Health issues is that people also become much more open to imposing rules or policies within the system to prevent people from taking more than their fair share of a common resource. Because through use of this system, by letting them experience what it's like to be on the receiving end of a system when those rules and policies don't exist. We're building one of these management flight simulators for chronic wasting disease in the United States, which certainly fits the bill for an intractable problem that feels almost unsolvable, but flight simulators can be really data hungry. So there are all kinds of other systems thinking tools, including completely qualitative ones, that I think could be really valuable to other One Health issues. The point being is that systems dynamics is a way of helping people wrap their heads around a world that's dynamic, evolving, and interconnected, instead of falling prey to our default mode of thinking where the world feels unpredictable and therefore outside of anything we can do to intervene, which is sort of a recipe for helplessness and hopelessness. But I also want to go back to that One Health definition slide that said we need to mobilize people to work together. So while systems thinking tools can help you get to the root cause of issues, when you're dealing with people, there will always be some part of decision-making that is values-based, where facts and data aren't going to help you escape from the need to have hard conversations with your colleagues, bosses, or the public. And I've observed among my colleagues, family, and friends that our own beliefs are sometimes what is holding us back from making progress. Some of us have convinced ourselves that someone else has both the answers to our problems and the responsibility for taking actions, or that the problems are too big for us to personally make a difference. And I totally get why we do this, and I fall prey to this way of thinking a lot. But I believe that leadership at its core is about figuring out how to strategically use ourselves, that authority figures don't have all of the answers, and that every person on this call is just as qualified to lead as everyone else. For me, I believe that healthy ecosystems and wildlife contribute to healthy societies. And since I spend more than half of my waking hours working at the National Wildlife Health Center, I want to be using that time to help this place and these people be the best versions of themselves. Right now, I feel like overall, we're still pretty focused as a center on minimizing the impacts of problems after they emerge. So my personal leadership challenge is to figure out how to mobilize at least some proportion of these scientists to evaluate whether we could be doing something differently to improve the health of ecosystems and wildlife. On the outside, I'm sure this doesn't sound risky to focus on my own center, but I can assure you that no one has been sending me flowers or balloons for my first 6 months as center director, as I encourage discussions on whether or not the epidemiological triangle view of disease management is allowing all these other hurdles to improving wildlife health to be someone else's problem. And then maybe now would be a good time to consider what types of tools and capabilities we need to improve health, as well as document its decline. I am certainly no expert at mobilizing people, but I do think it's a critical missing link in most One Health challenges. So I'm trying to raise the temperature at my center enough that folks will engage on the topic of how we, as a center and as individuals, can best contribute to improving wildlife health. In addition to wanting to more intentionally tackle the impediments to managing wildlife diseases, we've also talked about how we can create a process that will increase the likelihood that our science will continue to evolve as we gain knowledge about issues, and how we can continually evaluate and challenge what science we as individuals and as a center put forward in terms of what impact it's having on wildlife health. So we're working on a set of self-imposed criteria to continually evaluate the impact of our center's science. I'm not telling you any of these stories to pat myself on the back, but rather to share my journey of trying to create change around me and be more honest about how hard change is. Because if you've ever heard the phrase culture eats strategy for breakfast, it's come into play every day for every change I've been a part of. I believe we're all living in a system that's designed to do exactly what it's currently doing. And I've come to realize that part of the process is accepting that resistance only becomes personal if you let it. If you maintain your sense of curiosity and encourage it in others, strive for getting it right over being right, and purpose over ego, you can, maybe, I don't know, possibly check back with me in a couple of years, eventually figure out a way forward together. Thank you.
Thank you, LeAnn. You learn something new every day, and this tertiary intervention is a great term. Transdisciplinarity and understanding each other is extremely important, and language becomes, quite complex in the One Health field. So thank you, LeAnn, very much. I'm going to pass over now to Desalegne, who's currently in Addis Ababa, and hopefully can give us a sense of where One Health is going to matter within the context of one of the most interesting countries in Africa in the context of One Health, because of its massive livestock population, very large human population, and wildlife. Thank you.
Yeah, thank you, Richard. Can you hear me okay?
Fine.
So we hear you.
Yeah, I'm trying to put on a slideshow. Is that okay now? Yeah. So as Richard introduced me already, my name is Desalegne. I work for Ohio State University Global One Health Initiative based in Addis. We are registered as an international non-profit organization working on Global One Health. So I would like to share, some of our experiences and my insights as well. And as being as a second speaker, I had the opportunity to, most of the questions are answered. So why Global One Health? Specifically, this time there is an increased zoonotic spillover. Climate change is affecting many countries, including North, South. In the past couple of years, we remember that, Ethiopia, Somalia, Kenya, Eastern African countries have been impacted by heavy drought and hunger. And later on, recently there has been floods in Kenya and, Ethiopia as well. So there is a climate change impacting people and livestock. There is a population growth, urbanization, biosecurity and defense and biosafety are issues. So this is, bringing, new health challenges, including the emergence and the reemergence of infectious diseases. Antimicrobial resistance has become a serious, global, crisis. Food safety and zoonosis, non-communicable diseases are growing. Hunger and malnutrition still remains to be a problem in many countries. So this requires, building capacity of countries, institutions, individuals, especially we should focus on new skills, systems and technologies and collaboration, especially, focusing on global health security, as most organizations, working in global health, are focusing on global health security. So there are among the 11 health security action package. There are 3 priority areas: prevention, detection, and responding, which really require building capacity at like individual professionals, later on institutions, and as country level. This One Health global health security requires a holistic approach, including food safety, environment and climate change, zoonotic disease, antimicrobial resistance, foodborne and neglected tropical disease, and others. We all, as a holistic approach, all these areas need partnerships, resources, leadership and governance, communication, collaboration, and especially multi-sectoral collaboration within country and globally as well. And especially whenever we refer to One Health workforce development, it includes to address in-service capacity building, for undergrad and graduate programs. Also, pre-service training, in-service training as a refresher, and also community engagement. Ohio State started global One Health workforce development back in 2012. Of course, we are registered as an international non-profit organization in Ethiopia in 2016, but before that, Ohio State has been collaborating with different universities, including University of Gondar, which I was a president, and a number of exchanges have been we have been running a number of student exchanges from Ohio State to Ethiopia, and from Ethiopia to Ohio State. And so far, with the last 13 years, since 2012, we have been able to provide a number of courses, more than 130 courses, and more than 510 faculty involved, not only from Ohio State. We invite anyone who is interested to be part of our summer institute, including Europe, Australia, South America, and Africa. Many faculty have been participated all over. And since COVID, we make it more global, and because of the COVID, it became virtual. Previously, it was more of face-to-face, and we have been able to reach many countries. Professionals taking our courses from different countries, courses are free, live, and virtual. So these are some of the brochures we produce every year. For the last many years, we are trying to train more people. It's not only virtual courses, but most of our projects we implement in Ethiopia, we try to integrate PhD and doctoral students into our programs. One of our programs is One Health Eastern Africa Research Training, OHART, which is an NIH funded program, which involves Ethiopia, Kenya, Uganda. Recently, we have the third cycle, which are partners from Ethiopia and Kenya. So this program focuses on training PhD and postdoc students in foodborne, waterborne, and vector-borne diseases. It's not only for training, but it's just a kind of implementation and research. But we are having students engaged, and partly the training will be here in Eastern Africa, and partly some of the laboratory program, mentorship will be at Ohio State. Also, we have, just we are giving examples. We have a food safety project, which is funded by, FCDO and Bill and Melinda Gates Foundation. We work on, risk-based food safety, and we have PhD fellows, working with us. Also, one of the programs we started, back in 2012 was MA-PhD-VPS program in Gondar in collaboration with Ohio State. That's one of the first programs related to One Health, and we have been able to produce, graduates who have the knowledge of One Health, some, 12 years back. Also, we work with World Organization for Animal Health on, day one competencies. They do have, day one competencies for Doctor Veterinary Medicine program. We had partnered, Ohio State partnered with University of Gondar, but of course, about some 16 veterinary colleges in Ethiopia have participated, and this training program reviewed the curriculum, and now we have a national curriculum approved by the government of Ethiopia. Ethics is one of the areas that One Health should address. Ohio State University has partnered with the University of Nairobi the past 2 years, and we have been able to establish an MS program in One Health and emergency research ethics. Ethics is critically important, as one of the core competencies. So the key core competencies, of course, they're already mentioned earlier. One Health professionals need to have a better understanding of, background on health, be it, human health, animal health, environmental health. Leadership and management really matters, especially institutions, and leaders of countries which can champion, supporting One Health initiatives, can bring changes. Also, so already being said, systems thinking, communication, collaboration, teamwork, values and ethics are areas which should be addressed. It's not only the hard skills that we want, but the soft skills, the ethical component, the culture, all those areas should be addressed. Just as a recommendation, as we work closely with universities, the key areas that One Health workforce development should focus is the curriculum of undergraduate and graduate education. It should not be like an only in-service training. We should revise our curricula, be it agriculture, environment, human medicine, veterinary medicine, all areas, including social sciences, should address One Health at the level of the curriculum. Also, there are many professionals on the field, far from, information, far from internet, we should continue providing in-service training, refresher trainings. Also establish national and international One Health networks like, AfroHUN, the African One Health University Network, CHUN, which are really addressing curriculum, addressing professional students, One Health clubs, and so on. That's really important. Also strengthening national One Health platforms. There are different names in each country. These are critically important in multi-sectorial collaboration, bringing, different professionals, different stakeholders together on prevention of pandemics, detection and building capacity, laboratory capacity, surveillance capacity, and response on pandemics and epidemics. So that's really important. And also as a final, strengthening One Health academies, be it face-to-face, online, and virtual academies are critical, important. Here are examples. For example, this is from the USAID One Health Next Generation program. They do have such opportunities for online courses. Wherever you are, you can take such courses. As you can see, the courses are very diverse, and including epidemiology, including like antimicrobial resistance and others. So this is just an example, and we should promote One Health academies globally. So thank you so much for the opportunity, and back to you, Richard.
Desalegne, thank you very much. I think you brought a lot of important aspects of this. At the end of the day, we'll be judged on what happens on the ground. And the question we're trying to address today is about who do we put in place to ensure that it happens. So without wasting any more time, I'm going to pass on to Craig to please wrap up on the session. Thank you, Craig.
Thank you very much. And I do appreciate the other speakers setting me up quite nicely. And just to take a moment to say that I also appreciate the partnership with Cambridge University Press. The McEachran Institute's a newly formed Canadian nonprofit that's trying to think about how do we get ready for the future at this interface of people, animals, and our shared environment. So I'm going to talk a little bit about, are we training for the future, or are we using old ways of training for a world that really doesn't exist anymore? So I suspect many of you, like me, have put in applications using one or more of the words in that little word cloud down below. Each of them have different entry points and emphasis. One health's a little bit different than population. Medicine is different a little bit than planetary health and eco-health. But they all aim to inspire action in a complex, uncertain future through collaborative cross-sectional work. So are we really training for a complex, uncertain future? We recently completed a short study looking at One Health Masters in North America, and they're fundamentally teaching the same things I learned when I went through and did my epidemiology and public health work in the past. So I've been spending some time reading about what do we need to be ready for the future, not just in One Health, but in general. And it's very interesting across the board, including business and other areas of science. These 4 circumstances are important to be future ready. The first is to recognize the interdependence, not interconnection, but interdependence of human, animals, and non-human systems. It's also shifting from the specific solution to a comprehensive system-level solution, like LeAnn was talking about. They also recognize the need to have people who can take multifaceted approaches to address problems from several perspectives. And then finally, the other future-ready circumstances is to have cross-sectoral learning. So we start to share ideas and innovation and information and expertise throughout these complex problems. Now, to get there, we need 4 essential thinking skills. Number 1 is we need to be able to look at problems and solutions in new ways, to be able to link across problems. We need creative thinking, so that we're open to new ways of thinking. We don't get stuck in our old rut of how we've always done it. And we learn by the mentor that says, this is how I did it in my days. We have to be able to try new things, adapt, and learn. We need communication, communicative thinking, so we know how to mobilize what we know to those who need to know in a way that they can know. And we need collaborative thinking. That means not just using what you know in a new situation, but also incorporating what others know to get into, others know from different situations into what you do. Now, to get those 4 essential thinking skills, we need 3 intellectual capabilities. The first is learning agility. In other words, people have to be willing and able to learn new competencies and use them under new and challenging circumstances. So we don't leave our degrees with these set of skills and we just use those skills in everything that we do. Convergence thinking. We have to train people who are what I call specialized generalists. They don't have that depth, but they have that breadth to see the big picture of an issue, to think strategically. So they need skills to integrate knowledge and ways of thinking to achieve these transformative solutions. And then, as LeAnn said, we need curiosity. And curiosity, I'm going to take the prerogative to tell one quick story. When I went to university, to find an article, you had to walk up to the top of the library, get a book called Index Medicus, find where look up the keyword in there, find the papers, walk up, get the journals, look for that article in the paper. The best papers I ever found were the one below or above the one I was looking for. It was just serendipity, good luck. But now when we use keywords and things like Google and PubMed, we only get what we look for. How many of you read law literature? How many of you read philosophy? How many of you read public healthcare literature? We get stuck with the computers of decreasing our curiosity, and we need to be able to encourage these impulses to seek new information and explore new experiences and discover novel possibilities. So those are big challenges. We hear people say that all the time. We have to think about how we change our educational way. What path do we take in order to create these future-ready people? Well, the first thing we have to do, in my opinion, is we have to create opportunities to explore. We have to let these learners roam across disciplines and between different professions. And one big danger we have to look about in One Health is avoiding One Health to become its own cloister. We're starting to see people making One Health programs that are isolated over here. They might have different people come to it, but the learners aren't going out as often as they could to see how other people do things. That means we have to start removing disciplinary barriers in educational experiences, which will be very challenging because, as I said before, we still think a specialist has a depth of knowledge, not a breadth of knowledge. Curiosity, now this is at least the third time you've heard it today. How do we create programs and projects and stories and decisions that keep curiosity going, to get them to explore new ways of thinking so they know different ways of doing? The literature will tell us the better interdisciplinarians are the people who combine their disciplinary knowledge with broad interests and imagination. So how do we encourage that in our teaching? Students can explore, be imaginative, and take those risks to do something differently. Then they have to be able to experience the value of intellectual interconnection and interdependence. And I've highlighted the word experience there because they have to get the chance to try it and to do it. And they have to be rewarded for considering multiple perspectives and being inquiry-based. And that's risky because you can be wrong, right? They have to have the safety that they are allowed to learn from experience. They have to be able to learn from others. They have to be okay to be wrong and not just be punished from that. And that's tough in programs that value only on grades on exams. We have to incorporate new ideas and different opinions into what they do. And the faculty marking those might not have the ability to assess those. We have to allow the students time to reflect on what was learned collectively so they learn from each other. The other thing I think is really important is consequentialism. So I'm going to whisper this because we're talking about a One Health journal, but I don't care about building One Health. I care about making things healthier. And I know that I can only do that by looking at the interdependence. We have to focus on closing the gap between knowing something and teaching something and being helpful for the challenges that we're doing. And I don't care what you call that. We have to be focused on the consequences of what we're teaching people to do. And we know that the educational literature will tell us that adult learners learn better if they see a reason for what they're doing. So focusing on the consequences rather than the field will be really important to get some of these other attributes that I'm talking about. And then it's up to all of us to be role models. If you look at the literature on why people pick different specialties, apart from money and work hours, role models are really important. If we have faculty that they're teaching and saying things like, yo, you have to be collaborative and interdisciplinary and work with all these, and yet they go back and only see those faculty work on their particular field with their particular group, they see them as bad collaborators. They see them not being curious. They're not going to pay attention to all these things that we're telling them. So we have to have role models who can still progress in their profession. They can still get their valued promotions within their job. And that requires an academic structure that is a little bit more permissive and forgiving to allow their faculty, just like their students, to roam, think broadly, and be curious. And my last slide is LeAnn brought in the thing about sticking your head in the sand. And I remember somebody said, what does the ostrich see under the sand? And I thought, what does that mean? Certainly means that different viewpoints bring in different insights. Not a wrong, not a right insight, but a different insight. But we also know that when the ostrich needs to scan the horizon and see what's coming, they have to take their heads out of the sand and see those opportunities. So I think we need to keep that in mind when we're teaching and developing One Health, that we have to value the different views and insights that people bring from different perspectives, but be able to teach people to have those attributes so they can think about and be ready for what the future might come. Thank you.
Thank you, Craig. As usual, very inspiring. If I could ask the presenters to please ensure that their webcams are on, because they're going to answer some questions now. Thank you again to all of you for very interesting perspectives. And now we want to try and respond to some of our audience who have already provided some useful questions. So I'm going to direct the first ones to Desalegne, actually, because certainly Africa has many, many challenges. He mentioned just a few, and I've worked there for many, many years of my career. And when it comes to the One Health aspects, getting cooperation across disciplines is not easy. Culture, hierarchy, these are all the sorts of challenges. And I see one of our participants has asked that question really is, what are the sort of challenges that has he had, having been in the University of Gondar when it first started and setting up, academic curricula and so on. So in the One Health sense, I'd like to know practically what he found some of the biggest issues. Was it culture? Was it hierarchy? And most of the problems that one sees in health in a place like Ethiopia amongst the rural community where the majority of people still live. So how do we address One Health at that level? How does all this academic thinking really translate into something practical that will help both humans and animals and plants, as well as nature and ecosystems? Thank you, Desalegne.
Yeah, yes, great question. Thank you. So, in terms of the challenge, when we implement our projects, there are practical challenges. For example, when we submit a proposal for some calls, some sponsors do not understand the true One Health approach. So sometimes we go for where the money is. An example is we had antimicrobial resistance project we submitted with sectors from animal health, from human health, veterinary laboratories, hospitals, public health hospitals. But at the end of the day, sponsors, they go for one. If they're focusing on public health, they go for that. So it's not like it was, the sponsor should need to understand, how much, a holistic approach is critically important. But that's the challenge. And what many partners do is as long as, we do something on one sector, we go for that. But it's not a true One Health approach. So that's sponsors, funders, not all, but, some need to understand, that really matters. The other is I was invited in one conference. I remember very recently after the recent drought, which really impacted millions of people, and the stakeholders invited in that workshop were very few, but the problem is really complex. Animals are dying, people are starving, and that the problem is really complex and that really requires an integrated approach. So governments need to understand the importance of an integrated approach towards addressing such complex problems that really need One Health. This is drought, flood, really need typical One Health integrated approach. And for pandemic response, some organizations, they go by their own, but there is a national One Health platform that really brings different professionals from different sectors. So that's really important.
Desalegne, sorry to interrupt. I think what you're pointing out is that we do need these structures in place at government level and international level and so on to try and get these things to happen. But to get them to the grassroots is clearly an issue. And this particular webinar is about how do we move forward in terms of getting the right academics, the right communities. So if I could pass this over to LeAnn, because LeAnn, you're in a very pivotal position now with a perspective from nature, from wildlife. What opportunities are there, do you think, for training in this area from your perspective in the United States?
So what opportunities are there for training for moving us to, so Richard, are you referring to, so what opportunities are there for training for moving us to taking action or what?
Yes, I think to get something practical moving, we're talking about what sort of community can we bring together, who's doing it. There are a number of questions out there from this group saying, well, has anybody done this? Are there programs out there to help this integrated process of developing the curriculum, etc.? So I'm just wondering what your experience is of that. Do you think we're still way behind on this, or Or
Yes.
yeah.
I think
Yeah.
we're way behind on this. And I really enjoyed Craig's presentation because I think he touched on many of, he's famous for doing this. I feel like I have a thought and then Craig says it much better than I ever could. What I'm trying to do at the center is sort of, I'm using this as sort of an experiential sort of, not playground's not the right word, but I'm trying to see what works on this group of people. What works with this group of people who cared a lot about, you know, sort of wildlife conservation and One Health issues, and why are they stuck? Why are they sort of stuck feeling like they have to keep doing things the same way they've always been doing them? I think that Craig touched on a lot of sort of how we build these programs in the future, right? So what he said we should include in those training programs, I think are spot on, in terms of, you know, people needing to be allowed to fail, people being encouraged to be curious, those types of things. And so I think that there's a training program for it, but I also, and this is, I'm going to keep going back to it of like, I really think that this is a pivotal moment for everyone to look around at the group that they have contact with right now and try to figure out, how can I influence these people to do these things? What will it take to move these people that I can talk to right now, every day that I have contacts with, to move the field forward? So I think it's both. I don't think it has to be an either or. I think sometimes we get sort of locked into that mentality that like, okay, well, we'll just focus on the next generation. We'll train the next generation of people how to do it better. But what about the people that are doing this right now? And I can't tell each individual person on this call what they specifically need to do. I don't know their situation well enough to know that, but I continue to believe that we all have a role that we can start playing right now. We just need to all figure out what it is, and we need to have a lot of those characteristics that Craig sort of pointed out. That, you know, like, it takes bravery to do stuff, right? And I continue to believe that courage can be something that is acquired. Like, doing the hard thing is what actually leads to having more courage. And so I think that trying to figure out what that looks like for each individual person is sort of what I encourage people to take home and reflect about. I know it's not a very satisfying answer, but that's what I think is needed.
No, I love those, you know, it's having courage, it's understanding that it's a new way of thinking. And I'm going to let Craig just sort of finish on this. There was a question about, well, LeAnn intimated, you know, it's not necessarily the next generation we must wait for, but one of the people said, Janine Wendt said, what would you say are the most important lessons to focus on in an after-school program for kids? Craig, what do you think?
I think the most important thing for kids is to distinguish the difference between finding the truth and being helpful. In other words, our model, particularly in science, has been to go down to find a universal truth. And you're not going to find that in complex dynamic systems. But how do you look at, how do kids become savvy users of information? Because we're not in general. I mean, Richard, several times you've said, how do we get academics involved? We need practitioners. We need people who can understand to go out on the ground and do things. And I remember many years ago, we were in a discussion about an ecosystem health project, and there was all this debate about how do you define the ecosystem? And somebody said, an ecosystem is just all the things that affect the thing you're interested in. So if you're trying to get children to think about their health and the health of their environment, to be able to see the things that affect the things they're interested in, the choices that they make, the powers that they do, the things that their community is involved with, having them see and understand connections would be the most important thing to have the next generation, if we're talking about the children now, be better able to deal with the implications of the decisions they're going to make as an individual or as an institution.
Thank you, Craig. I think that's a good point to end on. We haven't, unfortunately, got time to go on debating, which I think we'd all love to do. And I just want to wrap up now and encourage everybody to communicate with us, put in questions, contact the Cambridge University Press, which we must acknowledge, you know, for this highly innovative idea of Research Directions One Health series journal. Please do have a look at that. I want to also thank Craig and his team from the McEachran Institute, which is a core think tank, and all those participating, you should have a look at the websites. try and engage and link up. And of course, all of us are there. And, you know, if you would like to ask questions, we'd be most happy to help. So if I could pass over to Casey to end the session, and thank everybody very much for this very stimulating webinar. Thank you.
All right. Thank you, Richard, and everyone. I just want to say a quick thank you for everybody for attending. Thank you so much to our speakers for coming and having this session with us today. For those of you that are interested, I did see in the questions, this will be available to view in post. We're going to be uploading this recording onto the website in the next coming days. So look for that on the website. We'll also be posting it over on our Twitter account. So you'll be able to see that there. There's also an email that will go out if there are any questions that you had in follow-up that we can get answered for you as well. But otherwise, thank you all so much for everything, and we'll see you next time.
Thank you, everyone. Thank you.